Welcome everybody for today's webinar as we want to talk about your high value instruments, and therefore I want to show you how to save your instruments, how to maintain your instruments in the best way, and of course according in Germany following the RKI, that means the Robert Koch Institution compliance things. Thank you very much for joining the webinar. At the end of the webinar, of course, I will answer all your questions. Please stay calm to the end of the training so that we can do all your requested questions at the end of the presentations. Thank you very much, first of all. First of all, I want to introduce myself to you all. My name is Gerhard Schaele. I'm one of the campus trainers and responsible for the complete instrument training in our company. I'm with the company since 1976. That means the last 43 years. I spent my career just for the KaVo instruments. I worked in the service management, so I did trainings for the instruments as well for service technicians. And since 1989, I do here the trainings for all of our customers. Okay, so let's go forward and start with the presentation. The key topics we want to talk about today, first of all the sources of infection and the risk of the contamination. Important for you, what would happen if care and maintenance is not done correct, or at least done because of misunderstandings, or it doesn't take place. I want to go through a guideline for compliant reprocessing, and of course the manual and the mechanical instrument maintenance. Why do we have hygienic maintenance? What you can see here on this slide is something we have since about more than 30 years, when we have here the risk of a cross-infection. When we talk about the things here, I just mark it for sure so that you can see it. We talk about that special place here, and we do have here a lot of direct influences from the dental unit to the client, the instruments and units which will be the target for today. Of course, we do have here contact to the prosthetics. We do have the wet areas. If the second patient will be waiting for you, as well the second one. Of course, all the social rooms, and important also the waiting area. Today, we want to concentrate especially for the instruments area, that means the inside and the outside of the instruments. The agents which are existing in not only dental offices, but overall when we talk about clients, doctors and medical staff, are various. The important points what we have here in dental branch, but this is something I think I do not have to explain too much for you, because the experts here are you and not me. So that we do talk about the periodontic bacteria. We have etiologics to tonsillitis, pneumonia and tuberculosis bacteria, and of course all the etiologic to the general infections like influenza, herpes, HIV and so on, which could occur everywhere. An important point, not only because in times of Corona or COVID, but important right now, is the spray cloud expansion, which we can see on the next slide. And when I click on here, you will see what happens. And this picture is not brand new. This picture was already made about in the 70s, and it still exists exactly like we have it here. we do have a spray cloud expansion in the circumference from around 1 meter, showed here in the blue field, and around 2 meters, showed here in the outer diameter. That means we still do have in an area from around 2 meters diameter and a contamination from around 50%. This means, first of all, we have to make sure that the cloud expansion should be minimized as good as possible to avoid the inhaling of the so-called aerosols. This will be shown later on. But for today, we talk about all the influence regarding dirt, regarding particles, regarding liquids, which are responsible for the shortness or the shorter time due to mechanical or contaminated influences. What is KaVo doing to avoid in the best way these influence from the outside into the instrument? We do have in our instrument range, when we talk about the high speeds or the turbines, that means air-driven instruments, in our master portfolio, the so-called master torque turbine, and here we are doing a special thing. That means we do have here in the master torque a so-called DST, we call it here quick stop. DST means direct stop technology, so that we avoid the retraction into the inside of the instrument. This is a problem for worldwide seen all turbines. What we did here, we want to avoid this so-called suck back effect into the turbine to avoid that we do have particles, contaminated material sucked into the turbine. Even if the turbine will be sterilized later on, we want to make sure that from the very first beginning that we have no particles sucked into the inside because of the phase out time of the turbine. How do we do this? We want to show it later on. One important point, most of you may know how an instrument looks in the inside. I just have here a small drawing from a so-called red ring or increasing instrument, and you can see how many single parts are necessary to drive an instrument, and each of these little parts is responsible for the transmission. That means we have clearly to say if one part is done by a lack of maintenance, this could affect the complete system in the instrument. And that means, just to give you an idea, if we have a lot of particles going in this side and we would have here a blockage because of dirt, this would influence as well the next parts and influence the next parts. So that means we have to see the complete instrument as one item, even if, for example, a red ring instrument consists out of more than 60 different parts. Of course, this is not only the question of contamination. We want to hold your investment on a very high level. That means the product durability is one important point, and which is as well very, very important, we want to give all the safety for you, for your staff, and for the client. How does this look like? Some of you may know how an instrument is built into the inside, and here we have a very nice picture how an instrument looks like, and I think that just only a few of you have ever seen the inside of a so-called increasing instrument. Here the speed of the motor will be multiplied, done with a so-called gear. In this case we talk about a so-called triple gear. This is our main instrument for removing enamel. This is an instrument called M29L. And the important point is for us that we want to have the instrument made it in that high quality that your investment will stay for a very, very long time. And one important point here to talk about is that the triple gear here is made that precise. When we talk about tolerances, we talk about here in this area from, to give you an idea, plus minus 0.01 millimeter tolerance. Just in comparison, a human hair will be about 6 times more, so that you can see how precise this will be. And of course, we want to avoid that dirt will be placed in here, and therefore we need 100% precise maintenance of the instrument. Important to know if an instrument is allowed to be sterilized, if an instrument is allowed to be put into a thermal disinfection. All of our instruments are marked on the body with these 2 signs. That means if you will see the sign of 135 degrees, that means this is the sign for the sterilization in an autoclave. If you see this sign on the left side here, this is the sign for a thermal cleaning in a thermal disinfector. And by the way, all of our instruments will have these pictures laser printed on the surface, so that whenever you are not 100% sure, just have a look on the instruments and you will guide it here through. By the way, of course, for all instruments, we will have exactly the precise description in the operating manual. How does it look like, and how do we talk about, and why do we talk about the hygienic maintenance? As in the slides before, you have seen that the instruments consist out of a lot of different parts, and one of the most important parts which are responsible for the correct speed transmission are the ball bearings in the inside. And I have here a small picture how this looks like. That means the instrument is made as well from these ball bearings, and each of the ball bearings will have a separate loading effect. And the influence of dirt, of particles, of blood, of salt crystals, of liquids, of chemicals will influence the lifetime of all movable parts in the inside. And we want to give you the possibility to understand the inside, because most of you will always see the outside of the instrument, but not the inside of the instrument. But the important point is the inner life of the instrument. And therefore, we will show you a bit more. And we come now on the turbines, on the high speeds, exactly to what I showed you. We want to avoid that exactly this will happen now. If we would not have this anti-rejection system at KaVo turbines, it's called DST, we want to avoid that all the particles shown here in yellow, will be sucked by the rotation into the inside of the turbine. And this is how we do it. That means in this moment, and each of you will exactly know this system, whenever you work with a turbine with a high speed in the client's mouth and you release the foot control, you have a so-called phase out time. That means it takes in between 1 or 5 seconds around till the turbine stops complete. And exactly this is the time where you have to hold the instrument very calm so that you don't have contact to the gingiva. And in this time, the phase out time, the rotor in the inside, the cartridge in the inside still runs till it stops. And exactly this time we reduced to less than 1 second. This is just a mechanical system how we do it. That means the rotor will be stopped automatically in between 1 second. And we have here as an effect a non-suction into the inside of the cartridge. This is very important, not only because of contamination, but as well we want to avoid the influence of mechanical damaging. That means all parts which are removed from the tooth, that means enamel, dentine, salt solution, salt particles, however, could be sucked into the inside and could create a problem, especially in the movable parts. And as good as possible, we want to avoid that these particles crawl into the inside and start here to create this mechanical abrasion. The less particles will receive into the inside, the longer you will have the lifetime. And the third effect will be that the chuck, that means the holding system of the turbines of the Red Wings, will not be influenced by sticked parts in the locking system. This is what we talk about, and this is, I would say, the main thing on the high-speed instruments on the turbine is this cartridge driven by air with a push-button system, which is showed here. And this push-button system should be also secured, and this will be secured by this anti-rejection, so that the less particles coming from the outside into the inside, the more reliability you will have. Just to give you a small overview what KaVo is working on, and we have it already on the market, especially for the master torque turbines. We talk about this direct stop technology. That means the burr, when releasing the foot control, will stop in between 1 second to lower down the risk of injury and to avoid the suction of particles into the inside of the head housing. Yeah, this is also called anti-rejection system, and we do work with 2 different systems that we don't misunderstand. We do have in the multiflex couplings already in the water line built in a non-rejection valve. The same non-rejection valve will be built in all KaVo motors, exactly there as well in the water line. And then we do additionally have in the turbine exactly this DST to avoid that also into the head housing, into the hollow body of the turbine, we do not have suction into the inside. That means we have here a double safety. First of all, the water line will be shut off so that water will be sucked back into the inside of the water line. And second of all, we avoid in the master series that we will have here particles sucked into the head housing of the instrument. On point 3, you see a word which is called Plasmatec coating. This is a special coating. We are working here on our turbines with first of all, a nickel chrome plating on all of our instruments on the master series, and the Plasmatec coating is additionally a special chrome nitride coating which will be placed additionally on the chrome plating. Every one of you knows this kind of plating when we talk about your daily life, your private life, when we talk about Teflon, and each of you is knowing Teflon, and Teflon, especially in the kitchen, for example, is made that first of all, the cleaning after the use will be done very easy. And that's exactly what we want to have here. We want to give bacteria no chance to settle down on the surface. And this will be done very good with a so-called PVD coating. The brand name in our case is the Plasmatec. But exactly here we have the same situation like on a Teflon plating, that if there are bacteria, viruses, particles or dirt on the surface, this could be removed very easy. We do have here shown on point 4 these minimal joints And whenever you have the chance, have a look on our instruments and feel with your fingers that there are no gaps, no holes, everything is done on the absolutely minimum. This is the question, how precise we produce our instrument to give dirt no chance to grab into these joints. Yeah, and that means the effect of that will be an easy to clean surface. On point number 5, we mention here high quality materials. This is something we always have to tell you, that we are trying to use in the inside of the instruments as good as possible the same material. We don't want to have different materials or a mixture of materials, because as today we know that when we follow the reprocessing, the instruments are regularly heated up in the sterilizer, heated up in thermal disinfection, and if we would use too much different materials, we would have a different expanding and a shrinking of the different materials, and this could end to a blockage of the gears or to different spreading and shrinking of the instruments. And as long as we are using the same material, we have the shrinking and the expansion of the material in a tolerance which is absolutely acceptable. When we talk about the instruments, we talk about steel. So, something which some of you may know how it looks like, but I have here some photos from instruments, how they arrive sometimes in the technical service. And these are here particles from a gear, from a red ring instruments, how it looks like after a while if the maintaining is not done the correct way. You can see here clearly some corrosion. We do have here also some blood particles. This is also some particles from the tooth like enamel, and this will stay in the instrument if this is not pushed out by the maintaining process. And you can imagine how this will affect the running behavior, how this will affect the holding system of the instruments. And the thing what we want to avoid, we want to have this always clear. By the way, LKI, that means Robert Koch in Germany, says clearly that only cleaned up instruments can be put in the autoclave system. That means an instrument like this should never go into the sterilizer. First of all, this should always be cleaned up in a very good way. I just have here some samples. This is the part from an intra-lux head, how it looks like, and you can see clearly particles placed here. This is not only a question of the mechanically problem which could occur, this is also the question of, is this instrument really sterilized when leaving the autoclave, or could there be some living organism underneath the different dirt layers? This is the reason why Robert Koch Institute says clearly only clean instruments, so that we do not have dirt layers in the instrument and give maybe some viruses the chance to survive the autoclaving system. Like here, this is from a head, and whenever you see things like that, or your staff, especially the persons which are responsible for the cleaning, tell them that this instrument should not be placed in the autoclave in this way. First of all, always clean up, but we come to this later on. Surgical instrument, this is a straight instrument, and you can here clearly see this is a combination which is done by blood, salt crystals, blood, everything will be placed in here, and this instrument was directly placed in an autoclave. We opened it and we saw how it looks like in the inside. One important point we want to talk about when we do the cleaning, that you can see how you do it the best way. So One important thing here, when we talk about prophylaxis, we have to talk about the polishing paste. And you can see here, this is the insert of a head which was used for prophylaxis. What you can see here is just polishing paste stayed in the inside of the head because it crawled into the chuck and stayed here in the front gear of the instrument. And you can imagine how this looks after a while when this will be filled up with particles in the inside and you sterilize these particles. The important point is here, these particles, they will stay in the inside, they will be baked in the inside from the heat. That means we heat up the instrument up to 135 degrees. And when we do this at certain times, you will have here one layer after the other built up in the instrument, and no cleaning procedure can clean up an instrument like this. The only possibility what we have here, if the instrument is not defect right now, we can open the instrument in the service, we can clean it up and try to survive with the instrument. But a circumstance like this, we should avoid exactly this case here. The comparison, how it could look like, an instrument when it looks cleaned up the perfect way. This is a straight handpiece, just the axle in the inside from a surgical instrument. This is an instrument which is completely dismantled from the axle. And on the left side, you can see here the holding system, a very old latch holding system, not clearly cleaned up, and the locking system from a cleaned up instrument, how this looks like in the inside. And this is what we talk about. We want to come to this situation to hold your investment on a very high level. So let's have a look to the reprocessing compliant to the German Robert Koch Institute. And we want to come to a situation that we want to be here and not on the left side. We want to be on the safe side, on the clean side, and not talk about instruments which look like this. LKE, compliant reprocessing of the KaVo instruments, and not only of the KaVo instruments, but instruments overall, starts first of all to divide instruments in different critical stages. When we talk about our instruments, that means turbines, straight handpieces, red rings, heads. We talk about semi-critical instruments, and we have to talk about critical instruments. Semi-critical, it's described here, are instruments which come into contact with mucosa, with membranes, or with diseased skin. And here we divide it, but this is something you know already, in semi-critical A and semi-critical B. Both should be cleaned and disinfected, and sterilization is recommended. When we come to the critical instruments, we divide it as well in critical A and critical B. Sorry. And the important point is the risk assessment and the application are always done under dentist's responsibility. That means the user of the instrument has clearly to divide the instruments into semi-critical or critical instruments. And the important point is that critical B instruments, which are hollow framed instruments, which do have contact to blood, which do have contact to penetrate the skin. Here it's written down here, in contact to blood or internal tissues, or organs, has to be, and that's by German law, Robert Koch Institute, first placed into a thermal disinfector, and second, and this is not only a recommendation, this has to be done, into a autoclave. If we talk about semi-critical instruments, the risk assessment has to come from your side, that you clearly say, okay, I do not have here this instrument used on mucosa with blood influence, however, so this would be enough to put it into a thermal disinfector without sterilization. But the critical thing is, do you always see if there is blood on the instrument? So we always consist to that way. Worst case scenario, if you are not 100% sure, go for the safe side and do the thermal disinfection and afterwards the sterilization. If you clearly know that this will not have contact to blood or mucosa, then disinfection will be enough. But as I said, the risk assessment, that's up to you. And the important point is always after the thermal disinfection, before it goes into sterilization, we have to oil the instrument. But I want to show this in the next slides. The steps for the reprocessing of the KaVo instruments will be going in an easy way, and I have here just one slide, and if you are interested to have this more precise, you will find all necessary documents on the KaVo webpage, possible for a download. I just make here a small slide to come through. That means to minimize the risk of the infection, always first of all, but this is something I'm sure that you do it already, that you have here the protection gloves. Second of all, remove the burr, and important, not written down here, but I just want to tell you, don't use any chemical liquids for the burrs or lay it into chemical liquids. When you do it, you must make sure that afterwards there is no stain of these chemicals stay on the surface of the locking system, that means on the shaft of the burrs, because every layer changes the behavior when you put a burr into the locking system. On point 3, remove the instrument from the motor coupling, of course. Yeah. When you have instruments with interchangeable heads, that means when we talk about old versions of the KaVo instruments, or when we talk about the master series where you can change the instruments, then please remove the head from the base for separate reprocessing. To oil it, in the Quattro Care, for example, there is not absolutely a need to remove it from the head, but we give the possibility that, of course, you can spray it separate as well. Of course, you should wipe the instruments immediately after the treatment, just for the safety of the stuff, of course, before it goes then to the mechanically reprocessing or to the manual reprocessing. What will be the difference of manual and mechanical? Clearly saying the mechanical reprocessing will be done with a machine, that means with a thermal disinfection. The manually reprocessing will be done for semi-critical instruments where you are in the way that you can do a manual disinfection on the outside. That's the big difference, but we will see this on the next slides. Here we have a workflow shown for you. That means what I told you here, and we separate the instruments here into semi-critical and into critical. Yeah, and you see that semi-critical procedure ends directly in this position. That means after cleaning up, that means the manually pre-cleaning here shown in the picture, after placing the instrument in the thermal disinfectant, and after the care, that means the oiling of the instruments, the semi-critical B instruments are now ready to use again. If we talk about the critical P instruments, then you have to wrap the instruments after the cleaning and the oiling, and that's an important point. Always make sure that the instrument will be oiled before you put the instrument into the sterilizer. It does not make sense to oil it in this procedure here before you put it in the thermal disinfector, because the automated system of the thermal disinfector will wash out all the oil. That means now, if the instrument is leaving the thermal disinfector, the oiling is a must before you bring it to the client. And it's also always a must to spray, to oil it before you put it in the sterilizer. We want to make sure that clean oil, which is, by the way, full sterilizable, will be placed into the instrument. Then it will go into the sterilizer. We always get questions, if I want to make it 100% safe, would it make sense to spray the instrument after the sterilization? The question is absolutely no, but the reason why is pretty easy, because when you have an instrument sterilized and you would oil it afterwards, you contaminate the instrument again, and this does not make sense. This is the complete original operating guide with the workflow compliant for the RKI. This is something what you can download from our website, and here the different steps are exactly described again, what to do for the instruments. If you have semi-critical instruments or if you have critical instruments, and this is divided into mechanical procedures or manual procedures, how to do it. Surface disinfections, we can just tell you, please use only the disinfections which are written and stated in our operating manuals, because only these disinfections are tested and only these disinfections are approved by KaVo. Of course, we know that there are thousands different brands on the market. The ones we can say you can use them are written down here. This is first of all the KaVicide or the KaVo wipes, as well as the Cabo wipes. This is called Microsid Liquid from the company called Schülke & Meyer in Germany. This is also the FD322 from the company Dürr, and VLCit and Minute wipes from a company called Alpro. An important point, always perform the wiping disinfection. No spray disinfection. The reason why is pretty easy to explain. Whenever you start to spray an instrument, you must 100% make sure that the disinfectant does not crawl in the inside of the locking system. Because here you could create a lot of chemical residues which will stay in the inside and which could harm the locking system, in this case, that it could not move that good way as only with oil. So just take a wipe, spray on it, and then you take the wipe or the tissue and you start to do the outer disinfection on the surface with a tissue. That's how we want to have it. How to maintain it? We offer with KaVo our so-called QuadroCare Plus. The important point here is we know that a correct maintenance of the complete instrument portfolio day by day and after each client takes really a long time. And here we give you the chance with the QuadroCare Plus that you can place up to 4 instruments at the same time into the machine. we do have on each of these adapters a single dose cleaning. We offer different adapters for instruments, that means motor-driven instruments and air-driven instruments like the turbines. The instrument itself does have a so-called chuck cleaning program which you could activate if you like to have that. The important point is we do not have an over-oiling because the system works that way. I just want to show it. The system works that way that we have here in the side a small spray can. When the oil is going out of the spray can bottle, it will be mixed up with air under pressure, and this foam, this oil foam, will be pressed through the instrument, and this oil foam with pressure is the cleaning effect. When doing it in this way, we don't need to have that much oil like with a spray can, because here this works like a razor foam. It expands up to around 250 times from the volume, and exactly this will be the cleaning effect. The one important point, the unit itself is adapted to pressure air, and this pressure air is following afterwards automatically. You don't have to press any buttons. Is following the oil and distribute now the oil in every niche of the instrument. You do not have to do something else. If you want to start the chuck cleaning program, this can be here extra activated if you want to do that. Just show you the couplings which are available. We offer not only for the KaVo instruments the different adapters, we offer it also for our other producers of instruments. You can see it for the NSK, for W&H, for Sirona, for Midwest, for Morita. Everything is available in the manual that you can order it. Basically, it will be sent out with 3 of the intra nozzles and 1 multiflex nozzle. And here it's shown how the separate chuck care program can be done. This will be always done on adapter number 4, which is shown here on the right side. You place the adapter on it, first of all, and then you can once a week, this is what we always say, once a week before you do the ordinary cleaning, first of all, oil the chuck to remove particles or to loosen the particles, and afterwards you do the ordinary cleaning program by placing the turbine, the red ring instrument or the head on the corresponding adapter, and then the already loosened particles will be flushed out of the instruments. The time to do a complete cycle with 4 instruments depends on the time of the adjusting, but it's around 1 minute that all 4 instruments will be cleaned and oiled. You can see here, this is what I already told you. That means we have here, this is a so-called plexiglass instrument that you can see what happens here, and you can clearly see here the foam going through the instrument, pressing all the particles through the instrument, so that at the end you will see dirt like oil drops in the inside of the unit. An important point to know, only KaVo QuadroCare bottles will fit and work in the QuadroCare. And herefore, the originally KaVo bottles will have here a barcode identification, and in the inside of the unit there is a small laser which is measuring the barcode. And if there is a third-party bottle which do not have this barcode, the machine will not start. This is the important point. As I said, we want to make sure that only proved and tested oil, that means the originally KaVo oil, will be used in our system. This is how it looks like. We just placed incoming instruments, for an example, into the inside of a Guatemal, and you see what happens now. Yeah, after the cleaning process, but this is an extraordinary sample for an instrument. Basically, if the cleaning is done correct, most of the oil particles will be shown like in a spot like here. This is really a very dirty instrument, and the important point is when you start to change from your cleaning system right now to Guatemal, it can happen that when you change to the Guatemal for the KaVo instrument, that on the very first attempts you could occur things like that, because the Guatemal itself takes also time to bring out all the dirt or the mistakes made in the past, and then on the first 2 or 3 attempts it could happen that you have really dirt like this. When you do a regularly cleaning of the instruments in the Guatemal, the maximum of dirt coming out should be like that. Because when you do it regularly, there is no time for dirt to settle down, so that the same clean oil will release the instrument like you blowed it into the inside. For those which not work with the Guatemal, of course we offer still our spray cans, and for those which know the spray bottle, we have 2 different sprays here. It looks like 2 different sprays. This is the bottle in the former edition. The new edition from the KaVo spray is shown now in a green bottle. The content of the bottle is exactly the same. We changed the complete design of the bottle for the new CI, for a KaVo logo and so on, but the content is exactly the same. We will have here different spray nozzles. The one for the intra motor-driven instruments, as well for the heads which will be stuck into the inside, and the second nozzle which will be used for the multiflex turbines. One advice from my side: whenever you use the spray bottle, place on the bottle, on one bottle, the intra nozzle. On the second bottle, you place, when you have turbines to work with, you place the multiflex nozzle and you leave it on the bottle. Don't start always to rechange from one bottle to the other. So this occurs to that phenomenon that somewhere the adapter will not hold precise. Then we have here one important thing, and this is the so-called clean pack. Some of you may know it. I will show it more precise why we use it. So first of all, again, the correct adapters which will be fit on the KaVo spray, and important for you to know the color of the bottle from the KaVo spray, which is used manually, is exactly the same like the bottle from the Guatemal spray. Please always have a look what is written down here. For the spray you use in the Guatemal, it's written down KaVo Guatemal spray, and this is only for the Guatemal. For the KaVo spray done mechanically with the adapters, you use the KaVo spray. The content is a bit different because we use a different kind of consumption in the inside, and the valve on the front is different. So you cannot use these adapters on the Guatemal spray. And this bottle would not fit into the Guatemal. So don't mix it up. That's important. Shown here more precise how to do it, and this is something you really have to show it to the persons which are responsible for the cleaning. You can here see clearly when you do the cleaning with a spray bottle how to stick the instrument into the clean pack. Never place the instrument complete in the cotton into the inside so that you cannot see the instrument, because When you do it the correct way and you have the instrument still visible, you can directly see here, when you spray through, you can see here what kind of oil is leaving the instrument. And if you see here dark brown particles or discolored oil, do the spray again, always for 1 second. Important to know, always hold the can upright. Never hold it over the bassin like shown it here, because in the bottle itself we do have the gas which is responsible for the pressure, and if you start to hold it in an angle, you mix up gas and oil, and then the cleaning effect is not 100%. So always hold the can upright and spray it for 1 second. If you see oil dirty is leaving the instrument, repeat it please again. We do have under spray bottle as well a special nozzle, and this nozzle will be used when you place it on the adapter for cleaning up the jug. Same situation like on the Guatemal. This will be done like that. You can see how you do it with the head, the blue, green and yellow heads, or with a turbine, or with a red ring instrument. That's the important. Just for your information, if you do the spray, the cleaning maintenance, in this way that you spray the instrument for 1 second, one bottle lasts for around 300 to 320 cycles, which is pretty much the same like on the Guatemal. That means the Guatemal bottle itself is good enough for around 320 cycles, but not complete cycles, single instruments. If you always fill up the Guatemal with 4 instruments, of course, then you have to divide it with 4. The Guatemal itself will give you also a visible and audible sign. If the spray can will be empty, there is a small blinking LED which shows you that the bottle will be empty. But even if during a maintenance process the LED starts to blink, there is still enough oil in the system to complete the cycle. When you then want to start a next cycle, then the machine would not start. Therefore, you have to open the lid on the back side, you have to remove the bottle, put a new bottle in the inside, and then you can restart the process. As we do have not only the KaVo system on the market, we are facing the situation that the company of Sirona, which is offering the Duck Universal, and we get a lot of questions. Can we use the Duck Universal or is it not allowed? Today I can clearly say, and this is not very new, but just official for you now, since March 2018, KaVo gives the allowance for the Sirona Duck Universal and for the Sirona Duck to be used with the KaVo instruments. This is an official system now, so that you can use it. But we always say that you should always bring, and this is also written down in the Sirona manual, that you always have to increase the oil quantity to the maximum. That's the important. Here it's written down to have an optimum of cleaning, just only in German, but I just translate it. We recommend always to use the highest step of the oil. After the cleaning, there is always discussions how to hold the instrument, to lay it, to stand it, to have the head upright, to have the head downwards. We clearly say here, we are using our instrument tray, which is, by the way, new and full sterilizable and also be used in the thermal disinfection. after using the instruments, and if you do not wrap them and you sterilize them, you can place them on the instrument tray. I always recommend to have 2 of them, one for the dirty ones if you want to transport it for the sterilization or during your treatment, and afterwards, of course, you can store it as well on this stand. The stand itself does have different diameters for the heads, for the turbines where you have these adapters, and of course for the straight and for the contra angles. This makes absolutely sense to have it. Everything is also written down, and this is important for you if you like to have that. Please go on the KaVo website, and here we offer you a download. It's called KaVo Handpiece Care. This is like a small Bible. And in this Bible, it's written down the do's and the don'ts of using the instruments. I just want to show you a few sides of that one here. First of all, we recommend only to use the originally KaVo spare parts. For us, it makes sense if you are willing to spend money for KaVo instruments. I think you agree that you want to have the best service and you want to have originally spare parts. And this is the guarantee for you that when instruments are maintained on the KaVo service stations at Biberach, at Warthausen, or in our settlements worldwide, that we can guarantee you the best service, and we can guarantee you also a 1-year guarantee of the done service. This is important. If you are interested in, go on our website, download it, because it's not only the question of the service, it's also protection, and everything will be described. The do's and the don'ts. For example, here you can see burrs which already spin round in the chuck, burrs like this one here, that you should avoid to use burrs like that because they create problems afterwards in the locking system, or never use burrs where in the locking system are these colored markings which are in the industry stand, so you can use them, but we do not recommend that because here we are losing the grip of the instruments. We do have here some small advices how to prevent damagings. Always control the instruments before you place them into the thermal disinfection, before you place it in the sterilizer. If there are some dents, it always can happen that the instrument drops down on the floor. Yeah, this fail can happen, but please control it. Even if you see dents like this one here, this could end in a special system which is called blocking of the instrument. Never use liquids, ultrasonic cleaners to clean up the instruments. And you find also all the documents. When you go on www.kavo.com, you will come on this download center, which I want to show you here. On the download center, you can go here to support. You will have here also, which is not shown here now, but hygienic, slide with hygienic. You click on and you will find all answers, and you will find the downloads to do your information, to download your information the best way. The summary of hygiene maintenance. What will be the summary of that? If we go into the inside, you will see why we want to have that. First of all, this is the most important point, your health protection. And when we talk about your health protection, that's the user, the doctor, of course, all the persons which are included in the stuff, and as well the clients. We will have a safer environment for the complete team. We will have, and this is an important point as well, a cost transparency, less unplanned expenses, less downtime. The important point here, to explain this and more precise, we recommend to send in instruments to the service before you have the breakdown. Just like you do a regularly service on the car, do a regularly service on the instrument to avoid high costs, because a broken instrument costs always more to bring it into a service condition, in a good service condition again, as when you send it in before you have some problems when we talk about mechanical influence. And this means conservation of value. That's the important point for you. More function safety, more reliability, and the coverage of all legal requirements. We do have all the norms, but this is also a download. We have it here just in German, but this is from country to country. You have different norms. I have here just mentioned the German ones. This will be from country to country different, which you can see on your things. So, hygiene maintenance of KaVo instruments. We will go now to your questions, which I can see on the side already that you have some questions, and I will try to answer all of your questions. Okay, let's have a look on the first one. Let's start with Mr. Roberto Breides. Hi Gerhard, as you will surely know, does anything. Yes, this is a question regarding the aerosols. The aerosols right now at the moment is a very, very big topic we are faced with, and I agree with Roberto Breides for sure that when we compare turbines with the red ring instrument, it's a question of the speed, and when you have an instrument which is not speeding up that much, you create less aerosols. That's 100% for sure. Right now, for all of you, I can give you the information that we are working on a PDF file. We have it already. And this PDF file gives you a little bit of support what to do and how to reduce the aerosols during the daily work in the office. This is a PDF file which you can order. Right now, I'm not 100% sure if it's already available for a download, but let me know if you are interested in, or contact please your sales rep in your country that you get the information about that. So then we have Mr. Mark Pitts. Hi Gerhard, referring the DST. Yes, it's so that 100% sure. One important point for the DST when we talk about turbines is the quality of the compressed air. That means the compressor should be done with a high quality. That means we should not have moisture in the driving air. We should not have oil in the driving air, but this is a question of when you have really old compressors or cheap compressors. Here it must be 100% safety that we do not have moisture directly coming through the driving air channel, because this is produced in the compressor. And of course, we should always talk about dry driving air. That's important. So there is another question. How often should the high-speed handpieces be lubricated? After each patient or at the end of the day? Very good question. First of all, I can clearly say at the end of the day, absolutely no, this is too less. It's written down in the manual for all instruments you use a minimum of 2 times a day. That means lunchtime, evening. When you use the instrument very often, permanently, it's absolutely okay when you spray it after each treatment. But now we come to the important point. How often do you sterilize? If you sterilize once a day, at the end of the day, you still have to spray it twice, lunchtime, evening, before the instrument goes into the sterilization. When you sterilize between each client, then you have to spray before you do it in the sterilizer. That means, just to give you an idea, if you sterilize it 5 times a day, you have to spray it 5 times a day before each sterilization. That's the important point. The background behind it, as I said, we want to make sure that no particles in the inside of the instrument stay there when you place the instrument into the sterilizer. If you do not sterilize the instrument because you clearly say, okay, this is a semi-critical B instrument, I do not have to sterilize it, but then you still have to spray it at least twice a day. If you do it more often, no way, it works, of course. Yeah, more often is not wrong. When should we apply lubrication oil? Before or after autoclaving? This is what I already mentioned. It does not make sense to spray it after the autoclaving because then you contaminate the instrument again. And secondly, it's so that the new oil which you sprayed in before autoclaving is removing the old oil and is absolutely sterilizable. So that makes no sense to spray after autoclaving. Next one, does it matter if the head is facing in or out when placed in the Guatemal to help protect the fans internally and the PCB? We always say it that way, that you place the instrument this way, that the oil goes towards to the bottom of the instrument and not to the door, because we want to see if there is dirty oil. We want to see the dirty drops coming out of the instruments, and they will be catched from the bottom of the unit, and there you can clearly see if this was clean oil leaving the instrument or dirty oil. Okay, so what differences between KaVo lubricants and others? Good question. Of course, we are testing others as well. The differences are so that we are checking the oil for our behaviors, and we don't do laboratory tests for other ones. If we would offer the different oils from other producers for our instruments, we have to test, I would say, at least 100 or 200 different oils if they can be used or not. And so we stay for our original oil and make sure that if something would happen with our oil, we give the guarantee for that. We cannot give the guarantee for third-party or second-party oils. But basically, it's so that our lubricant is tested in our laboratory under our laboratory conditions, and we do have, I think, the best solution, as we are working in one complete package. We offer the instrument, we offer the lubricant, we offer the machine, we offer the dental unit, everything in one complete package. The anonymous, is it mandatory to disconnect the head every time before sterilization? Yes and no. Yes, when you can dismantle it, that means on the master series, where you can take it off, and no, if the instrument head is fixed on the instrument, so it's on. So you don't remove it, because therefore you should have a special tool to remove it, and this special tool is only needed for the service technician, only in the case when the instrument will be serviced. But all instruments which do have a fixed head, the fixed head will stay on the instrument. Only for the master series, where you can interchange the heads, then you can take it off for the cleaning. You can place it separate for the sterilization. Why KaVo does not work on titanium handpieces? Good question. We believe in stainless steel right now. I could give you another answer maybe in a few years. You never say never. At the moment, we are still believe in our instrument because at the moment it's so titanium does have one big advantage. Titanium is very light. But titanium does have one disadvantage. It's not as resistant against mechanically influence like stainless steel. And this is why we believe we stay with the instruments on stainless steel. The one thing what we do on our instrument, as we are working with stainless steel, we can make the frames as well very thin to have less weight, but still a very, very hard and resistant material. And this will be plated with chrome nickel and on the master series as well with the Plasmatec coating and give a very, very hard and durable surface. So, some more questions. I'll just wait for you. Just go through again if we find some more questions. Okay, so far. So if there are no more questions any longer, I'd like to thank you, all of you, very much to join the webinar. I just want to recommend again, have a look in our website, and you're always welcome to contact me when you have questions about the instruments. Just have a look, phone through, or go to gerhard.schaele@kavoker.com, and I try to answer all of your questions. Just when you get more questions, or when you have more questions about the instruments, contact me. I will always be happy to support you with my knowledge. Let's have a look. Thank you so much. The recording is already on the KaVo Academy. You will find this recording then on the KaVo Academy. This will be shown on the already done webinars, and there you will find it. How can I get a certificate for participation? This is something, send me please a mail, because this is something what I have to check out.